I wondered what to do for today really and what to say. So I wanted to look at one of the sorts of things that I do really. We're going to look at routine testing for Down syndrome, but I've written quite a lot on different kind of testing for different things in pregnancy. My background is that I'm a philosopher as well, so I come at this from, I guess, a different route from lawyers, but it's something that I've found really interesting to look at law, look at policy and try and really pick it apart and understand what's going on there. And I wanted to use this as an example of that kind of thing that I do as a philosopher working with lawyers. And it's really just a quick snapshot, a quick overview of the sorts of things that I do. But do get in touch with me and we can always talk about this in more detail. So as I say, I've been doing this kind of work for about 21 years here. I'm a philosopher. I've worked with medical lawyers and philosophers for all that time. And my main area of interest has been in reproduction. And I'm particularly interested in looking at the way that we treat pregnant women and the way that we cope with all the things that come up. And I guess, as I say, one of the things that I wanted to do today was just show you a little bit about the sort of way that I approach these problems. Looking at the kind of headlines that you see about a new scientific discovery, possibly in kind of reproductive issues where they find something new, it looks great, it's in all the papers, lots of people talk about it, and just trying to pick that apart and look a little bit behind those headlines. And I guess that's just an example of the sort of thing that I do. So the example I wanted to look at today is this blood test for Down syndrome that was in the news a few years ago now, but it's quite interesting. So at the moment, there's a routine test for Down syndrome that everybody who goes for antenatal care gets, but it's not hugely accurate and there's a risk of miscarriage with that test. And I'll tell you a bit more about that in a minute. So what happened was a new test came about, a brilliant new thing happened. They came up with a new test for Down syndrome. The idea is that they look at the woman's blood, the woman who's carrying the fetus's blood, and they try and isolate the fetal DNA within that blood. So just from a blood test, they can tell Down syndrome and other genetic disorders. Any pregnant woman knows that every time they go anywhere near a healthcare professional, they take blood from you. So it's not a massively invasive thing. They're going to take blood anyway, and they can look at the blood and find out very accurately and very safely whether your child that you're carrying has Downs. And for me, this was one of those kind of examples of something that appears in the news, everybody just says, hurrah, this is brilliant, let's move on. And I wanted to just, for a few moments, and I won't go on too long, just pick that apart and just show you that I think that sometimes these cases are a lot more complicated than we first think. So this was the kind of scientific research that brought all those headlines to the fore. And this was the work done on this fetal DNA. And as I say, at the moment, we do have a routine test for Down syndrome that every pregnant woman is offered. They can opt out of that test, but they're offered it. It's a test where they do a scan at about 20 weeks and they check the thickness of the fetus's neck, but they also do a blood test. And between those two tests, they can get a kind of rough estimate of whether you're in a high category for Down syndrome. But the problem is that it doesn't give you an absolute answer. It doesn't definitely tell you whether your child that you're carrying has Downs. And the only way you can do that is to do something more invasive like amniocentesis, where they take fluid from around the fetus. And of course that becomes more risky, much more risky than just using leftover blood from the mother. You're going in and you can cause infection and even miscarriage. So you're talking about having a 5% false positive rate, and within that we're having people having amniocentesis that may not have needed to have it because their child wasn't affected, and you've got this risk of miscarriage. So you can see why a new test that avoids all of this, it's cheaper, it's non-invasive, no risk of miscarriage, brilliant. It's just one of those great good news stories. And they're trying to use it to detect other genetic disorders as well. There's further research being done at the moment to see whether it's going to be introduced in the NHS. I think it was being done at Great Ormond Street. But it's already there in the private sector, which is quite interesting. So I found this nice advert here that shows you that you can have this test. They're saying it's 99% accurate for Down syndrome. You can have it. It takes 30 to 45 minutes for the appointment, so they're just going to take the blood and talk to you about it. They charge you extra if you want to go in on a Sunday. It's an extra 300 quid for that, but I guess it is Harley Street. So the private practices are doing it already. It's not going to be risky for the fetus, it's not going to be risky for the mum, and if they're happy with the accuracy, then what's not to like? So for lots of people, this just seems like a really straightforward good news story. Women will get more information, they're not putting themselves at risk, they're not putting their fetus at risk, and it just seems like an example of a good news story. But I've got a few issues with it, I guess. And some of the issues are around the way that pregnancies seem more generally. So, as I said, at the moment, we already have a routine test for Down syndrome. And that means that you can opt out of the test. You'll be offered it routinely, but you can say no if you feel that you don't want to have it. And that's with the existing double test and with the amniocentesis. At the moment, if you get to the amniocentesis stage, I guess you've got quite a good reason to refuse the amniocentesis if you know that there's a risk of miscarriage. So say, for instance, you weren't really that worried about whether your child had Down syndrome or not. Certainly it wouldn't make you change the course of your pregnancy. You might refuse the amniocentesis that really gives you that definite knowledge. And I would say that you will probably be respected in doing so because of this risk to the fetus. But the problem with routine testing is that it's a very different way of testing from the way we normally do tests. And outside of prenatal care, we don't normally do routine tests. We normally think that if somebody wants to be tested for something that's quite important information for them or their family, that we would offer the test and let them opt into it rather than opt out. And there's little support for routine testing anywhere else apart from during antenatal care. So we don't see calls for routine testing for HIV in the wider community, but there is routine testing for HIV in antenatal care. So antenatal care is seen as a special case, and of course it may be a special case in some cases. There may be good reasons why we're allowed to treat pregnant women differently. But what I wanted to look at the last bit of this presentation is just to think about whether this is that kind of case. So this quote is from the guy who was one of the lead scientists on the original research. And you can see he's really, really excited. He's done a brilliant thing and good for him. And he thinks all pregnant women might want to carry out the test. And we can see that he's, part of this push to really test pregnant women for as many things as possible. And as I say, well, maybe I'm just being a bit hysterical about this. Maybe I'm just, jumping up and down, because it does seem like a good thing. It's cheap, it's accurate, it's safe. What could be wrong with that? Well, my problem is that routine testing is just a bit coercive. And we've been talking about people being allowed to refuse things that they don't want to have, and all these kinds of control over our lives that we think it's important that people have. Routine testing isn't really like that. It does push you in a particular direction. I think because this Down syndrome test doesn't have the risks that the other one has, it's going to be really, really difficult to dig your heels in and say, actually, I don't want to know whether my fetus has Downs, because you haven't got that kind of reason of saying, well, I don't want to cause any harm, I don't want to cause a miscarriage. So it's going to be quite even more difficult than I think it is already to say no to this test. And for me, a routine test definitely manipulates women's reproductive choices. It pushes them in a particular direction. And I think if we're going to do that, we need to be pretty sure that we're justified in doing that. And I'll briefly just talk to you a little bit more about what I mean by this. So, routine testing, coercive. You may be thinking, well, you can opt out. What's so bad about that? I think even though you can opt out, the idea is that you're putting pressure on women to be tested. We want to get more people than would have just opted in if it was offered to them to take the test. That's why we made it routine. We wanted to get more people to have the test. So there's coercion in having the test, even if it means you can ultimately say no. We are pushing you in the direction of saying we recommend this test, we think it's a good idea, and if you don't want to do it, you've actually got to opt out of this. So we're pushing you in a particular direction. And I think there's coercion further than that as well. There seems to me at least to be a hidden message there as well, saying, well, why is it a good thing that I should have this test? And there does seem to be a hidden message there saying, well, it's good to have this test because you might want to think about terminating this pregnancy. And I have no problem with anybody terminating a Downs pregnancy, but what I'm worried about is people not making choices that they feel are the right choice for them because they've been pushed in a particular direction. And we see this all the time in medical ethics and law, that we want people to make choices that they feel that they can live with, choices that they feel were authentic to them as far as is possible. And the routine test just pushes them in a particular direction. So again, you know, maybe I am being a bit hysterical about this. The NHS says, look, you know, it's up to you. You can opt out. You don't have to have it. You know, just don't do it. It's fine. We know that, you know, you can opt out of these tests. NICE here says it's a woman's decision and it should be respected whether they have the test or not, even if this is contrary to the views of the healthcare professional. But then it says that the purpose of the screening is to allow things like termination of pregnancy. And it's really difficult to separate those two things, I would say, to separate this recommendation from the possible consequences. And I found a couple of quotes that came out around the same time as the blood test information came out. And this was what I was hearing when I ever talk about this to kind of the public or to midwives, is they say these things to me. They say, well, you're led to believe it's the worst thing that could ever happen to you if you have a Down syndrome fetus. And that because you have a test, you think that it must be a terrible thing if it happens. So because this test is so important, they've made it routine, it seems to send a message to people who are undergoing this routine testing. Just a few interesting stats here. This is an article in the BMJ. So the number of Down syndrome pregnancies has risen dramatically, I guess because women are waiting before they have children, so it increases the risk. But actually the number of children born with Down syndrome has reduced due to them being picked up by screening. So without the improved screening, the number of babies born with Downs would have risen by 48%. So it's quite a big rise. But about 92% of all people who find out they definitely have a Downs fetus do terminate the pregnancy. So it's the vast majority, which I think are interesting statistics to just use as background. So what I'm saying is I've got no problem with the test. It is a hurrah story. Brilliant, we can do the test for Down syndrome. For those who want it and give them accurate information that won't harm their fetus. But what I've got a problem with is the way that it's likely to be offered. It's likely to replace the existing routine testing for Down syndrome. It's likely to be something that you're going to have to opt out of. And from my experience, it's going to be quite hard to step away from. And as I say, it's made even harder by the fact that there's no chance of miscarriage anymore. So you really, they're saying, well, it's just a blood test. We're already taking your blood anyway. You might as well know. But the coercion, I think, that's involved in that is really difficult. We might be justified in coercing people. We do it all the time. If you're overweight and you go to your GP with a bad foot or whatever, they'll tell you to lose weight. The same with smoking. There is this kind of idea of autonomy goes out the window when we feel we've got really good evidence to put pressure on people to go in a particular direction. But I'd say we'd need to be pretty careful about that and be sure that this is that kind of case. So what could it be that would make that kind of case in this case of pregnancy for routine testing for Down syndrome? And I guess there'll be two sorts of things that there might be. One might be that we thought we were preventing harm to third parties. So we often think we can override people's views if we can save somebody else from being harmed. So if somebody in here was found to have Ebola, we wouldn't worry about carting them off whether they liked it or not and putting them in quarantine because it would save everybody else from any harm. But we have to think about whether this is that kind of case. Does testing for Downs really save anybody from harm? We can't cure the Downs, they're either born with it or not. And the other one that comes up in a lot of the literature, and I guess is the kind of the nice one that people like to use, is empowering women with information. If we give women this information about their pregnancy, they can make better choices about what they want to do. But it's really difficult to see that routine testing actually does give women this information. When they're asked about, well, what routine test did you have? People don't even know they were tested for Down syndrome. It seems not the greatest way to give information out. And for me, it seems if we're trying to empower women, then pushing them down this particular route to a particular choice doesn't seem to do that, even with the information that it might be given. So for me, it's about thinking about what we're trying to do here. If we're trying to reduce the number of babies born with Down syndrome, then routine testing is probably the way to go. You get a high uptake of the test and lots of people end up terminating the pregnancy. But if we're trying to empower women, which is what a lot of, at least the NHS guidance talks about, then for me, it seems a bit troubling and whether routine testing really is the right way to go. It does seem that by giving this test routinely, we are pushing people down a particular route and curtailing their choices rather than expanding them. Thank you very much.